Hi, FreeBody family. Kat Matlock here in Asheville, North Carolina at the FreeBody Clinic and Training Center. And I am excited to share with you today about the relationship between the hips and the low back. See, the whole purpose of this channel is to help you to gain more and more understanding about the body, how it works, how things work together, and how things get off and dysfunctional together. And I've been at it 30 years and I'm still learning all the time. So I'm writing this book right now about like trigger points and fascia, stress in the brain, pain, how all those pieces come together. And I learned some things that I didn't know, or that really put some things into a deeper level of understanding for me. And this relationship between the hips and the low back kind of sunk in to a deeper level. So I want to unpack this for you and help you understand this to help kind of feed the efficiency and efficacy of the work that you do with your clients, especially your clients that are having issues in the hips, sciatica type symptoms, weakness in the hip, and aching in the hip, and also low back pain, right? Low back pain is a big piece of a lot of people's puzzle. So let's get started. The low back muscle, quadratus lumborum, is a hip hiker. It goes from the lowest rib to the top rim of the pelvis. And I did release a treatment on releasing the quadratus lumborum and also the psoas. Psoas and quadratus lumborum are spooning all the time. They're just snuggled up together. You'll want to check out that video because at some point you're going to want to do some work with the psoas and you want to do it well, and it's got to be slow really to release quadratus lumborum. But now we look at what's below quadratus lumborum, and that might be pulling on it and causing it to get a little bit jacked up. Those muscles are the abductors, abductors, the gluteus minimus and the gluteus medius. Gluteus minimus and gluteus medius are hip lowerers. They pull the hip down, whereas quadratus lumborum is pulling the hip up. So these muscles get into a little bit of a tug-of-war between each other. Now, I've always had that in my mind, and I've been teaching that for years. But the new piece of information that I learned was that trigger points in the gluteus minimus and gluteus medius can activate and keep reactivating trigger points in quadratus lumborum. And I find it interesting that if we look at the trigger point pain referral patterns of quadratus lumborum, it goes right across the side of the pelvis and can ache in and around the hip joint, right there where gluteus minimus and gluteus medius are living. So that's kind of interesting. That's kind of cool. Makes sense to me. But they can get into this tug of war. And so if you are treating someone in their low back, in their quadratus lumborum, right, nothing works in a vacuum. There's no end to the pieces of the puzzle in many ways. But if that QL is kind of stubborn and not really letting go, and their pelvis is kind of jacked up on one side, or if they're having weakness in their hip, you're going to want to look at the glutes at some point, and you're going to want to do some side lying work on the glutes to open up that gluteus medius, work on the gluteus minimus, and help to alleviate that tug of war, that pull between the glutes and the quadratus lumborum. So the other piece is that the gluteus medius attaches along the top rim of the pelvis, and so does the thoracolumbar fascia. So recently I've been teaching a bit to you all about that thoracolumbar fascia and its importance with your folks with back pain. Well, here's just another muscle that attaches into the thoracolumbar fascia, which lays over the quadratus lumborum, and that muscle is the gluteus medius. Its upper fibers kind of weave and become continuous with the thoracolumbar fascia. So it's directly pulling on the connective tissue, on the fascia, and it's directly pulling on, that's gluteus medius, gluteus minimus, pulling on the quadratus lumborum. So they're kind of wrestling in there. So if your client is having some low back issues, SI joint pain, a whole host of issues in the hips and the low back, make sure you spend, even if you're not going to do treatment of the gluteus minimus and medius, specific trigger point treatment, at least some soothing or some compression or just some soothing along that outer hip line and across that top rim of the pelvis, down the glutes. Compression on the glutes is really beneficial, really helpful. You'll find that that will free up the low back tissue considerably before you even touch or try to release those muscles in the low back. So direct relationship between the glutes and the outer hip and the quadratus lumborum in the low back. It goes both ways. If you're working in gluteus minimus and gluteus medius, and those muscles keep getting jacked up with tension, and you're like, what's going on? Which is often the case, right? You're not with your client all the time. You don't know if they're always crossing one leg over the other, or if they're always standing with their weight on one side. Those are things that contribute to problems in quadratus lumborum and problems in the glutes and problems in that whole system. But if you've been working in the glutes, spend some time in the low back, because there's a direct relationship with the pelvis, that pelvic rim, the ilium, laying in between the two. And one's pulling this way and two are pulling this way, and they get wrestling. Now, what else is right above that iliac crest is also the obliques. So just doing some nice soothing and some pulling, you can treat the trigger points in the obliques, but even just soothing and softening those obliques is going to help quadratus lumborum release, is going to help glute min and glute med release. So if you're not sure, just work kind of all around the area, work real specifically in the hip, and then just go below, work a little bit in the side of the quads along the iliotibial band, work a little bit down the hamstrings, work a little bit up into the low back, like just expand all around there. I have seen people get really fixated, and I probably was too early in my career. I was probably a little bit more fixated on like just going from trigger point to trigger point because I was learning and I wanted to figure it out. I'd literally lay my books on top of my client's back and be like, okay, I want to help you. Is it okay if I just lay my book on your butt right now so that I can work in your low back and follow the diagrams? Like I literally did that for years. And especially when I was working in a new area, and I'll still pull things back. There are muscles I don't work on very often, right? Just like you, there's probably muscles you don't work on very often. So pull the books out, open your computer, pull a chart up and just say, hey, I want to learn this. And if you're not sure, and if you're not comfortable doing that, just kind of go all around the area. Make sure you extend your soothing and don't get so hyperfixated on one muscle. It is never one muscle. And so sometimes in a treatment protocol, I'll just do the whole body. Sometimes I'm like, hey, let's just kind of go check the suboccipitals. We've been working in your low back. Your suboccipitals are probably like, what's going on down there? Things are changing, right? So everything is connected to everything else. And quadratus lumborum and gluteus minimus and medius, the AB or abductors, are directly linked through the ilium, pulling on each other, maybe a little wrestling act going on in there. Work both areas for the greatest help for your client. So leave us a comment. I love to hear what you have to say. Ask me questions. I'm here to serve you, and I look forward to seeing you in the next video.